The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Praise God, for I'm fearfully and wonderfully made. This is a beautiful quotation that's found in the Psalms. Welcome to Wonderfully Made. I'm so glad you took time out of your busy and hectic schedules to join us. Today we're going to talk about the important topic of heart rhythms. My name's Dr. Jim Markham, and I'm a cardiologist with the Chattanooga Heart Institute. And with me today is Dan Miller. Dan Miller is a businessman from Chattanooga as well, but he's also a consumer advocate of healthcare. And I'm so glad he's here, and our goal today is to talk to you as if we were right there in the house with you. We've collected questions from all over the world dealing with this important topic of heart rhythms. What we've done is hopefully we can cover everything of interest, and Dan's going to, if we talk a little bit too technical, Dan's going to sort of correct us and slow us down a little bit, and he's going to make this so everyone feels like we're right in your living room today talking. So Dan, with that introduction, let's get going with the questions.
Okay, thank you, Jim. The first question is from Brenda. She lives in Atlanta, and she's 38 years old. She works as an executive secretary, and her question is this. She has noticed that her heart pounds and races at times. It usually happens when she's preparing to go to bed, and it really bothers her. Okay. What could be causing this?
Well, Brenda, that is an excellent question. Many people, especially in your age group, have this problem with pounding hearts. Dan, have you ever had a problem with a pounding heart?
Yes, I have.
Now, have you ever noticed any time of the day when this pounding usually occurs?
Generally in the evenings.
Generally evening. Well, that's a common time when pounding does occur, and the reason pounding occurs then is there's so much stimuli that goes on during the day, and at the evening time, people start to notice and slow down a little bit, and then they start feeling things that they normally wouldn't feel when they're too busy during the day. Well, Brenda, the most common cause of this in your age group would be something that's called premature ventricular contractions. Sometimes we just call this PVCs. This is very frequently. Now, how do I know that without testing? Well, I don't. But the way we would test is put a fancy device called a Holter monitoring device. Have you ever heard what a Holter monitoring is?
No, I haven't.
Well, let me explain a little bit about what a Holter monitoring is. That's a special device we put on electrodes, and we can tell every beat of your heart for X amount of time. We can measure it from 24 to 48 hours. And this is one of the most useful tools that we have to detect rhythms of the heart. Let's put up our first graphic regarding premature ventricular contractions, or PVCs. Many different things can cause these PVCs. It could be a structural abnormality within the heart. That is, the heart doesn't work well. It's either too weak, a valve's messed up, or some other problem. Caffeine. In the United States, caffeine is a frequent cause of PVCs. There's certain over-the-counter drugs that can cause it, especially those for cold medications that have a substance called pseudoephedrine. Stress is a cause of PVCs, and there's a host of medical problems that cause these premature ventricular contractions. So this is a very common problem, Brenda. And getting back to your question, I would be very curious, if you were my patient, whether you did have a structurally normal heart. And I would ask you a bunch of questions about the stress and medications you were, and we probably want to put a monitor on you.
Does Brenda's age have any bearing on any of this?
Well, in pregnant years, okay, when we think of PVCs, is something is causing stress to the heart. Right. And that stress can come from anywhere. It can come from the job, not sleeping well at night. It could cause from a substance like nicotine or caffeine. It could come from being scared. If I scared you, Dan, today, if I go boo, you would jump and you might have a PVC. Well, all these things can cause the heart to skip. In this age group, another thing that we have to keep in the back of mind is, could this person be pregnant? that would put definitely a stress on the heart. What happens physiologically when you're under stress, you make a hormone, and that hormone's called epinephrine. And that epinephrine is usually what causes the heart to skip and beat. Right. And one of the treatments that we do if the skips are just unbearable and we can't do anything is we try to block that receptor with medications. So Brenda, what could be causing this? Well, back to your question, it could be the medicines you take. It could be that a rare cause would be a structural abnormality, but usually in your age group, it's just the stress of everyday life that's causing the skip beats, and that could cause for many things.
Right. All righty. Let's go to our second question then. This comes from Mel in Toronto. And the speed of his heart is about 38 to 42 beats per minute. He takes Atrial for high blood pressure, and it's making him very tired. Do you think that he needs a pacemaker?
Oh, okay. Mel, that's a question we hear a lot of. And before I ask you a question, a lot of people don't even know what a pacemaker is. Have you ever seen a pacemaker?
I have not.
Okay, well, I brought a pacemaker with me today. And this is a pacemaker, and this keeps the heart going when it's not beating strong enough. And the way we have this pacemaker is inserted right here under the skin, and here is a lead that goes inside the right ventricular chamber, and sometimes we put a lead in the top chamber, which is the right atrium, and this not only beats the heart, but every single beat that the heart does, it can monitor it. Right. And we have ways on a pacemaker we can tell everything that's happening within the heart.
Now, what is this made out of?
Okay, this pacemaker is made of a substance, an element called titanium, which is very stable in the body. And these are special plastics that go in the body that the body doesn't react to it, so you don't have a bad reaction or anything like that. Pacemakers are one of the most frequent treatments we have for heart disease. Before we had pacemakers, when a heart went slower and slower and slower, it would just stop. Right. And if a heart's not beating, we have no blood pressure. And one of the first pacemakers that went in, I don't know if people realize this, was, did you ever hear of Alfred Hitchcock?
Yes, sir.
Okay, well, Alfred Hitchcock had one of the first pacemakers. And back in those days, the pacemakers were about the size of my hand, and it went in the belly. And that's what it took to keep his heart going. But through the years, as you see, the pacemakers have gotten smaller and smaller. And it's my prediction that someday they're going to be on the size of a computer chip.
Now, can these be monitored any other way than... How does the monitoring process work?
Well, we have a couple ways we can monitor it, Dan. One of the ways we can do it is with a handheld device over it, that we can tell every beat that the heart has. Another way nowadays, we can actually download the information that's stored in these computer chips on the internet. Right. And I can actually see every beat of a patient's heart for a long period of time, in addition to see how often the pacemaker is used, to see when it's wearing out, to see when it's, the battery might need to be replaced.
So you're saying I could be traveling somewhere?
Oh, yeah. You
could monitor me from long distance.
Totally mobile with the pacemaker. Right. Another thing that people don't realize is some people ask me, can I get into MRIs and magnetic fields? Well, usually we advise not to get in an MRI machine. Right. Now, an MRI machine is a fancy machine that takes pictures of you because it's got such a strong magnet it can pull on that. We don't want it to be pulling on someone's heart.
For instance, like in airports and restaurants and stuff like that, they've got the signs up.
Right, you can still go there, but it would detect metal in you, and the alarms would go off. So it's frequently a cause of, especially now with all the problems we've had at the airports, it's a very frequent problem. But you know what? We forgot to answer Mel's question here.
Yes, we did.
Mel, making you tired. Well, could the rhythm be making you tired? It's going 38 to 42 beats per minute. A normal heart runs about 70 beats per minute. So the rhythm itself might be making you tired, or it might be the atenolol. Atenolol is a medication which slows down the heart. It slows down the wiring of the heart, so that could be making you tired. Do you need a pacemaker? A pacemaker is needed usually when the heart can't generate enough blood pressure to supply the brain. So you might feel dizzy, you might pass out, you might feel weak. Those are symptoms that would say, hey, I think you might need a pacemaker. Let's go up to our second graphics that has to do with when a person might need a pacemaker. And here are the indications for a pacemaker. The heart's too slow, okay? Well, Mel's is going too slow, and he's tired. Well, so he's having some symptoms. Usually we see dizziness, so that might be a reason. Conduction disease, what that means is the actual wires of the heart, the batteries, the thing that keeps the heart going are diseased. And the last thing is sometimes people need to take the medications to slow the heart down. The medications are so important to slow the heart rate that we put a pacemaker in just so the patient can take the medications. So sometimes in that instances, those people also need a pacemaker. But Mel is taking a medication which could slow his heart. So the first thing that I would do with Mel here is, Mel, I would stop your atenolol and use a different medication to treat your blood pressure. Right. And then I would put a monitor on you, one of these Holter monitors, and see what the rhythm's doing and see if any more symptoms occur. If more symptoms don't occur, I don't think I would worry a lot. Now, another thing, Dan, I might do is I would watch Mel's heart rate when he walked. You know, lots of people, athletes, go very, very slow when they're not doing anything. But if it speeds up when you do things, that's a great sign.
Right.
Now, let me ask you a question.
Okay.
Do you know, many people don't realize this, do you know, when do you think, what part of the day do you think your heart goes the slowest, and what part do you think it goes the fastest?
I would say slowest would probably be in my sleep.
That's correct.
Fastest would probably be when I first wake up.
That's right. If you're not, that's great, Dan. I mean, you're on top of this. If you don't have a lot of stress on you or other outside stimuli, like you're getting cut or hit, your heart's going to go fastest in the mornings because the hormonal system starts kicking in and slowest at night. In fact, I've seen people's hearts on these monitors run with no problems at all, run in the 20s to 30s at night. It goes pretty slow. Right. And that's when the body's resting. The heart has a time to catch up from the day. So, Mel, good luck with your heart, and I hope that answered your question.
All right. Let's go to question number 3. It's from Robert in Pennsylvania. He says, I'm a minister of a 1,500-member congregation in Pennsylvania. We recently had a parishioner die after the morning services. What are your thoughts on getting an automatic external defibrillator?
Okay.
And most of his congregation is elderly, so this is really something that concerns him.
Okay. Well, this defibrillator issue is coming up more and more. In the Chattanooga area recently, we had a young person that actually died from one of these dangerous heart rhythms. Right. It's very rare for a young person to have these, and every year you hear about a football player that has one of these abnormal rhythms that was otherwise undetectable. So the issue is should everyone in different places carry these defibrillators? Because if you can get a defibrillator to a person quickly, you can literally save many lives.
Right.
And the economics of it is, you know, should these big churches where there's lots of people that could potentially have an arrhythmia from a heart problem die? Now, before I answer this question, I just want to go over, out of all the causes of death in America, the most likely cause of death is going to be cardiovascular disease. And a lot of people don't realize that 43% of all deaths in the United States is due to cardiovascular disease.
Right.
Now, that's greater than wars and cancers and infections and everything combined. An interesting statistic is if you have a heart attack, guess how many people, guess what percentage dies before they even make it to the hospital from a heart attack?
I have no idea.
33%. Most people don't think it's that high.
Right.
But if you have a heart attack, there's a 1 in 3 chance that you're going to die before you even make it to the hospital. That's why these defibrillators are so much in the news and so much, everyone's wanting to talk about them. Thoughts on an automatic external defibrillator. I think this would be an excellent thing for your congregation. And the training involved really is very simple. In fact, we brought a defibrillator with us today.
It isn't at this point in time. Let me put this on you, Jim.
Well, and we're going to sort of pretend that the first thing we do is we turn it on.
Show everybody how it actually works.
It's not that hard to work, and you'd be surprised how easy it is to work. And if you're looking at Robert, if you're looking at the show this evening, I want you to sort of put this in the back of your mind for your congregation. A lot of people think it's hard to work, but it's not very easily. Okay, is the device on?
You turn it on.
Okay, and we're going to get things going here. Okay, I think it's ready to open up.
You push the button on the front of the machine. The device opens up.
And you have to hit it again.
Push it one more time.
Okay, this device, we're going to have to get it going here. It's supposed to come on here. It talks to you actually when it comes on.
Correct.
Now, we have a trainer with me today, so let's back up.
Call for help now.
Here it goes.
So this point is where I call for help.
Remove clothing from chest.
So I would remove
And
my...
at this time, right, you'd be laying on the ground and I'd take your clothing away from your chest. We're going to install this on your shirt, so you'll need to take your jacket off.
Pull red handle to open bag.
So I would pull this out.
Peel each pad off blue plastic.
When you
And
pull that
apply
out,
pads to exposed chest.
you'll tear the two pads in half.
Remove clothing from chest.
So it repeats it if you don't do something right, or you can't
This one
remember.
actually has a picture showing us where to put the pad. So I would apply that one at that point.
Pull red handle to open bag.
Okay.
I would pull this one
Peel
off.
each pad off blue plastic.
This one goes under
And
your
apply
arm.
pads to exposed chest. Do not touch patient. Evaluating heart rhythm.
And at this point in time, it automatically evaluates.
Stand by.
Okay.
Preparing to shock. Everyone
So I
clear.
would get out of the
Do
way.
not touch patient. Delivering shock.
Okay. Well, as you can see, was that the first time you've ever done this?
Yes, it is.
Now that was not too hard to put on, and yet if I really would have had a dangerous heart rhythm, that potentially could have saved my life. I would have really wanted this on that young person that day,
Right.
you know, that happened to collapse in a gym. I would really want this on because if someone could have been trained to put this on immediately, it would have saved his life.
Correct.
Now, a question we might get is can you mess up with one of these? I mean, can it...
Can you be shocked accidentally?
It is, I've never heard it happening, and it's only, the reason it didn't shock me is because my heart rhythm was normal. But it's trained to only shock that abnormal heart rhythm, which is called ventricular fibrillation or ventricular tachycardia.
Right.
That's the ones you see people over people's heart shocking it, you know, dramatically.
Like in the hospital.
So, Robert, that's how you use these, and the price of these defibrillators are coming down every year. One of the questions that comes up is, what about the liability issues? You know, are you liable if you have one? Are you liable if you don't have one?
Right.
And these are being worked through right now, but most people have a short training course. They have to be basic life service support. But when I talk to people about whether they need one of these, I say, well, you just don't choose it not to for the legal reasons. I mean, you want to have this to save lives.
Save somebody's life.
And if
correct.
you didn't have it, what would happen?
Right.
And what's the worst thing that can happen if you mess up?
Do it over, I would suppose.
Right. I mean, but if you don't even have the machine, you know, someone's
You don't even have that chance.
Exactly.
Correct.
And if you don't get the paramedics there within 5 minutes and deliver that shock, that patient has very little ability of having significant long-term recovery.
Right.
So Robert, there it is. That's a defibrillator, and we hope you consider getting it. And if there's any more questions, the people that run these defibrillator companies, they're on the websites. This one happens to be one done by a company called Medtronic. They are more than happy to give you information on this.
It's extremely easy.
Okay, well, we stopped it. Hope it doesn't go off again.
Let's not.
Okay, we don't want it to start talking. We got to finish this show, Dan. So with that, let's go to the next question.
Call
Okay.
for help.
Well,
Let's leave that closed there. And the next question will be from Lynette in Tennessee. The speed of my heart races at times. I was at Disney World a few years ago and nearly fainted from this rhythm. I have 2 small children and live an active lifestyle. This rarely occurs. Should I be concerned?
Well, yeah, the speed of the heart races. You can go ahead and put that up if we need to. Lynette, this is a good question. In the heart, there's sometimes groups of cells that become very, very unhappy. And these cells can generate a fast rhythm. And sort of a generic name we gave for that is a big name. It's called supraventricular tachycardia, or the heart goes real fast. And sometimes when the heart goes fast like this, you don't get blood pressure to your head. And that's what makes you feel so poorly. One of the things we say when it happens, okay, lay down and put your feet up, and you can sometimes rub on this part of your neck, and sometimes this will actually slow your heart down enough until you can catch your breath. If it continues for a long period of time, you really need to go to the hospital so we can either put a monitor on you or get an EKG to see what this rhythm's about, because you don't want to be having this rhythm when you go down with your kids.
Now, could a ride at Disney World have brought that about?
Yeah, I guess it's possible, but usually these rhythms are triggered on their own. I mean,
right.
Most people have these that they're doing nothing and then it just comes on. Now, we do know that there's some triggers that make it worse. If you're dehydrated, sometimes you can take a stimulant from the heart, and some of the more common stimulants that you might see at a theme park would be stress from two small kids all day.
Standing in line.
Yes, if you don't have the fast passes, you have to stand in line a lot at Disney World. Another thing, we talked about caffeine. If you get dehydrated, if you're not drinking all day, don't have enough fluid, those are some other things that could trigger this rhythm. And people that just have it rarely, I recommend no treatment, just monitor. But if it happens on a regular basis, more frequently, we can actually go up inside a body and destroy these dangerous heart rhythms now with a small amount of energy.
Right.
And if people don't want to do that, we can also take medications. Now, is it a person's fault that they have this? That's, no, not really. Most people are just sort of born that way, and they have these abnormal pathways, and they have to just live with that.
Right.
So, Lynette, good luck with your rhythm, and if it keeps coming on, I would go see your healthcare provider.
All righty. Next question is from Earl in Minnesota.
Okay.
He says, atrial fibrillation runs in my family. I am 86. My doctor says I have arterial fibrillation, and he wants to put me on a blood thinner.
Ooh.
I don't want to.
Okay.
What do you think?
Okay. Atrial fibrillation is another one of these rhythms of the heart. Now, we didn't talk much about it earlier, but the normal rhythm is called a sinus rhythm.
Right.
That means each rhythm is generated from this special battery that God gave us called the sinus node. That's a normal rhythm. So if it's going too slow, we call that sinus bradycardia, or too slow of a heart rhythm. If it's going fast, we call it tachycardia. Those are normal rhythms of the heart, but just going slow for another reason.
Right.
Sometimes you can have sort of these misconnections that we talk about. And if it's coming from the top part of the heart, this abnormal firing from all sorts of funny spots, we call that atrial fibrillation. And that's where the top part is literally going like this. It's just squeezing all over. It's not working symmetrically with the bottom part of the heart.
Right.
And guess what happens to blood if a heart's squeezing like a bat of worm when it comes through?
Squeezed out?
Well, some of it's squeezed out, but not as much as normal. But actually, when it's moving like this, you can get blood clots because the blood doesn't pass through. And if a blood clot gets in there and it passes through from the upper chamber to the lower chamber, and the lower chamber pumps that blood clot somewhere, it could go to the head and cause a stroke. In fact, about 15% of all strokes in the United States are caused by this rhythm, atrial fibrillation. So, Earl, that's why your doctor wants to put you on a blood thinner. He wants to lower your risk of having a stroke. Now, is there some people that don't get a blood thinner? Yeah, if the risk of bleeding outweighs the risk of the blood thinner, then you wouldn't get it. And you have to have frequent monitoring when you're on Coumadin. Now, do you know what Coumadin really is?
I do not.
Okay.
What is that?
Coumadin is rat poison. A lot of people don't like to realize that it's just rat poison. A lot of people don't like to take it because it's rat poison.
Right.
But it has lowered the risk of having a blood clot in the body. And in atrial fibrillation, you have to evaluate the risk of being on the blood thinners, whether you can take in the monitoring versus the risk of falling and bleeding. These are all very important things to think about when you're on Coumadin. But Earl, if you came to me and you had atrial fibrillation, first of all, I would say, Coumadin needs to be considered, but the next thing I'd want to look is the different causes. It's a very common rhythm. And with that in mind, let's bring up the next graph about the causes of atrial fibrillation. Okay, remember, this is where the top part's going faster than the bottom part. Sometimes it can, again, be because there's something wrong with the heart itself. That is, there's a structural heart problem. It might be that it's stretched out. It might be the valves that's bad. There might be an old heart attack. Something's wrong with the heart itself that's causing it. Sometimes you can have a thyroid condition. Remember, the thyroid regulates these rhythms. You can have a thyroid abnormality. Sometimes high blood pressure can actually cause cause this rhythm, atrial fibrillation, because it stretches it out. And there's a host of other causes. And Earl, I want to sort of go through some of those other causes with you, just in case you might have one of these. Again, we talked about being dehydrated,
right,
having an infection. Certain medications can sort of cause it to be more likely to happen. Just being sick can cause it to happen.
Correct.
Now, one of the things that the heart likes most is oxygen. Okay, and we found that people that don't get enough oxygen, so if Earl has a lot of lung disease, right, that could be a trigger for this atrial fibrillation. Right. And in this rhythm, you feel pretty bad if the heart's going too fast. So atrial fibrillation is one that usually you have to go in the hospital to get it treated. So it's a pretty tough thing to have. So I think Coumadin's reasonable. And the other thing, if we can fix the underlying cause. If you have problems with your lungs, it's an infection, you're not getting enough oxygen, let's fix that.
Right. Now, do you have to do tests to balance the amount of Coumadin that you're getting? Can you get too much Coumadin?
Yes, you can, and we have to frequently check the blood to see if the blood is too thick or too thin while on your Coumadin, because if it's too thin and you bonk your head, you could have a very, very serious problem.
Right. In the slide, you also mentioned that the thyroid has a lot of problems. There are a lot of people with thyroid problems in the United States today, it seems like.
Yeah.
I personally have some problems with mine, and so that's something that's even beneficial for me to remember.
Right. It can go, too low, too high. Thyroid's a very common regulator of the heart. It regulates the heart speed. And actually, a lot of people don't realize, but a low heart rate can cause you to have a slow heart. Now, before we close today, I wanted to show the people, we've talked about rhythms. We've talked a little bit about the slow ones, a little bit about the fast ones, and today I just want you to get interested in your heart rhythm. One other thing I'd like to show you that we brought with us today, this is a defibrillator. Remember, earlier in the show, we had an external defibrillator. Now, what an external defibrillator is a device that we put on immediately when someone's having a sudden problem with their heart. Now, this device in people with weak hearts or people that have diseased heart that needs this technology all the time, this can be inserted under the skin and it can deliver a shock, and this one can actually pace the heart anytime it might be needed. Well, we're almost out of time today, Dan. I want to thank you for joining us. I hope that the audience has learned something about the rhythms of the heart, the fast ones, the slow ones, a little bit more knowledge about what to do. And we hope that all of you can have hearts that never go out of rhythm. And we hope that God will create in you a new heart, one that depends on Him daily to keep your heart running smooth